Hello everyone. So this video is about dengue infection. Dengue is a viral infection transmitted by the bite of an infected female Aedes mosquito. Here are several symptoms of infection. The first one is that you may have high fever. Second, you may have severe headache, followed by nausea and vomiting. Next, you may have muscle and joint pains. And finally, you may have pain behind the eyes. There are several dengue virus serotypes. For the first one, it only comprises of the common symptoms. For dengue virus 2, it includes spontaneous bleeding. For dengue virus 3, it includes circulatory failure. For dengue virus 4, it includes profound shock. Here are the methods to diagnose dengue fever. The first one is NS1 test, next is antibody test, and then we have NAT test. Up next, we have RT-PCR test, then we have ELISA test, and lastly we have Western blot. For NS1 test, it detects the non-structural protein NS1 of dengue virus. It is detectable during the acute phase. For a positive NS1 test result, it indicates a dengue infection. It can be conducted fairly rapidly and at a low cost compared to other methods. So the next test is the antibody test. The antibody test is where we detect antibody that is produced in response to the dengue virus. There are two antibody tests. The first one is the IgM antibody test. IgM antibodies present during the acute phase. It will remain in the body for 3 months or longer after infection. The second antibody test is the IgG antibody test. IgG antibodies appear as early as 3 weeks after infection. It will present if there are any exposure to this virus in the past. After that, we have the nucleic acid test. It is very sensitive and has high specificity. It has the ability to differentiate various dengue serotypes. It can be only done during the acute phase. It is less sensitive after 7 days. A negative NAT result doesn't confirm that you don't have an infection. Now we have the RT-PCR test. It is the initial conversion of dengue virus RNA to DNA using reverse transcriptase. Dengue serotype-specific RT-PCR primers were used to detect an acute infection and to determine the infecting serotype. Gene C and gene E of the dengue virus were amplified using these primers. PCRs were then optimized by performing serotype-specific uniplex reactions using dengue virus culture supernatant.